Hello, I'm Dr. Van Merkle, and you might be thinking about becoming a patient, learning more about science-based nutrition, or just want to know if there's good natural options. And that's what we're here for. If you're looking for a second opinion, a safe, natural option, I think you've come to the right place. If you're a doctor looking for some ways to help your patients more, check out my lectures. I've been training doctors for years, and we can help you with a system that's going to help you take care of your patients more effectively, more efficiently, and help them get tested easier too. So let's go over some things here. Part 2 of Consider the Possibilities of patients that I've had in my practice as well as other doctors I work with. And maybe these will get you excited about the potential that we have to help patients and family more. And this is me. You can read this information. But I'm just going to not go into great detail on these, but just give you the overview of some of the cases I've seen. Here's a lady who was diagnosed with hepatitis for 5 years, had been on interferon and ribavirin. This is before the time of the new hepatitis C cure, the Harvoni, etc. This is years before that. And she wanted a second opinion. She heard about us, contacted me. We did the testing. And in 3 months, her viral load was back to normal. The viral load for hepatitis C is a special blood test. The QuantaShort test, which tells you how much virus there is. And even on interferon or ribavirin, it didn't help. But after just 3 months on a program we put her on, her viral load was back to normal. Now, interestingly, her MD was upset that she didn't do the interferon, that she stopped it and dismissed her as an uncooperative patient. She told me the MD seemed upset that she improved so much without the drugs. Well, how annoying can that be? Where's their professional integrity, curiosity? I tell you, if there's something better that's getting better results than I am, I'm going to know what's happening, what they're doing. They don't even want to know. But the thing is, natural treatments, and sometimes these cures for cancer they have out now may cause other problems. And I have some firsthand reports from patients whose spouses died, termed cured from the hepatitis, but died within weeks from cancer that the treatment caused. They were cured of hepatitis, but died from a side effect of the drug that cured the hepatitis. So I'm not sure how much that happens. Maybe more than we're aware of or more than we're told, but maybe trying a safe natural option would be better. The cure is well over $100,000. Treatment for this, maybe a few hundred, a couple $1,000. Might be worth a try. And here's one of our members, how hard it is to do if you're a new doctor. Here's an extreme case, just some of the things I've seen. This patient was probably one of the top 5 nearly dead guys I've seen. He was about 60. He came in very bad shape. His wife's the head nurse here at Miami Valley. And he said, I feel myself shutting down every day. He looked like he could just stop. He was so bad. His test showed his cholesterol is over 1,000. Triglycerides over 5,000. Truly, this was an extreme case. I did my consultation. I did the report, provide the solution and vitamins, and truly in 2 weeks, from June 21st, this one, to July 6th, the cholesterol dropped from 1,090 to 194. From nearly 5,000 triglycerides to 82. Truly saved this guy's life. It's a pretty fun case. I go into more detail during my lecture. And in one of these cases, I'll go over into more detail too. But I want to give you an overview now that even in-stage extreme cases can respond very quickly with the proper, when you know what you're doing, you get the proper testing. And we use lab testing, objective lab testing, to see where they are and to make sure that they're truly better. And here's another one. Very exciting too. Not as dramatic as the other one, but cholesterol of 621, triglycerides 766. And in 2 months, now she had irritable bowel, headaches. She'd had 4 breast biopsies, sinus and ear infections, hives frequently. But in 2 months on her program, her cholesterol dropped from 621 to 198. Triglycerides, which are an indication of inflammation, dropped from 766 to 199. Feels better. Everything greatly improved. Thyroid is back to normal. Lost 20 pounds in 2 months. Not bad. Is off all of her prescription drugs, including Synthroid. Wow. And her hot flashes are greatly improved in just 2 months. Testosterone. And we've got many cases of these. If you go back to look to possibilities number 1, you'll see another very good case of testosterone, even greater than this one, but this one is still good. This fellow had low testosterone, 125 for many years. He had been on testosterone patch and had taken shots, but it didn't help. Even on the testosterone patch and the shots, his testosterone was only 125. But on our program, after the testing, he went off. In fact, when he started a program, he went off all testosterone, all the shots, patches, everything. And at 4 months, his testosterone had increased 200 points to 325. Among other things, he says he feels 1,000% better. He is not on any, quote, natural hormones. He's not on AEM, DHEA, melatonin, or anything like that. If you get the body healthy enough, what's going to happen? You see, low testosterone is never the primary problem. There's always something deeper going on. If you give somebody testosterone, their production drops. So giving a man testosterone is absolutely the wrong thing. DHEA is the wrong thing. And I'm going to explain those, and I've explained those in other videos. So the big overview is where we're at now. And here's the doctor who added it. Parkinson's, 72-year-old male, 2 years on a program. And he'd had Parkinson's for 2 years. And he would get stuck. He'd have problems moving. He was shaking all the time. He kept a button in his mouth because his tongue quivered all the time. And he had problems speaking. And he would cry all the time. And very frustrated. But after 4 months on the program, he's 40% better. He's not shaking. In fact, he stopped all his meds. He's walking better, can jog now, which you wouldn't do because of unsteadiness, weakness, and angina. He's better with people. Emotions are better. Doesn't feel like crying all the time. Talks better. Stutters much less. Is more with it. And he's back to preaching. And he stopped sentiment and levodopa. 13 months on the program now. He hasn't gone back to levodopa. His symptoms are 90 to 95% improved. Parkinson's tremor gone. He's walking 3 miles 3 times a week on his own. Stuttering, quivering at times resolved. Sense of humor has returned. Patient is much more lively and talkative again. Patient is able to return. Patient is doing very well. And after 6 years, still doing very well. He did pass away from a heart attack, but look, at least his quality of life, he passed away very quickly. His quality of life was much better for the time he had left. 12-year-old boy with rare genetic disease. I've done a whole case study on this. It's been published. I presented to medical conferences. This is a phenomenal case. And his mother said even medical doctors haven't gotten results like we have. I go into great extent on this on another video. But this boy with osteopetrosis, the genetic disease, it's a brittle bone disease. And the boy's mother's side of the family all have it. His uncle was in a little minor fender bender and broke like 20 bones in his body. So this boy at 12 years old got it and has symptoms long before anyone else's family had. So did I think I'd cure him? No, and I didn't tell her we'd cure. But my goal was, I said, could we get him healthier and help him? And we did. And he had such a phenomenal results on his lab work that no one has ever seen before. And patient responding well and is now 17 years old. We started him at 12, responding now. But his marker for osteopetrosis went to 0. He had one of the highest numbers in the family, if not ever, the trap, and after a few months, it went down to 0. Wow. No one's ever done that, his mother said. And so very exciting. Crohn's disease. 54-year-old male, which he had been having trouble with since as a boy. And after just 3 months, digestion's under control, never felt better, no nausea, dermatitis is gone, fingernails good, increased energy, and there's no blood in the stools and normal BMs. And we've got so many cases. If you'll watch the videos, you'll see, in fact, you'll see other doctors talk about their patients with Crohn's and irritable bowel disease, etc. Female, 46-year-old female, all this is, this lady, 46 years of age, was losing weight dramatically, just so quickly. And her CK, creatine kinase, which indicates tissue breakdown and often muscle breakdown, was extremely high. Her body was dying, and she was losing muscle mass because the body will break down muscle to try and free up nutrients for more important function. So the body was breaking down. The LDH was high because of something happening in the body. And I feel like keeping you in suspense. I could keep you in suspense, and I think I'll go over more detail on this in a later video. But the CK dropped on 11/14 from 7,320 down to 1,207. Let's say they're supposed to be under 200. It dropped 6,000 points in 4 days. Saved this girl's life. Dramatic improvement once we find out what's going on. So if you got mysterious stuff happening, you don't know what's going on, you need to go get tested. You need to come to a doctor like me, like I've trained to learn to look beyond the regular testing. And that's what we did. She'd been to many doctors, and she was a skeleton. She was about 6'6", 5'6", and she was down under 80 pounds, and she was not going to be here long if we didn't find a solution, and we did. So very exciting case, phenomenal case here. Liver cancer, one of the worst I've seen. And when I saw the patient just before, in probably early November, I thought to myself, this patient will be dead by Christmas. Lucky to see Thanksgiving. But I didn't tell him that. I just told him what to do, and he followed the program, and he had one of the most amazing recoveries. I can hardly believe it. He went skiing over Christmas. In 3 months, liver cancer marker plunged from 4,163 down to 128, dropped 4,000 points in 3 months. This is amazing. No chemo, no surgery, no radiation. Liver nodules disappeared, sleeping through the night, off 2 prescription meds, and phenomenal results with that. Just very exciting. And here's another doctor who's using science-based nutrition in the system in his office. Another doctor who's using this. Kidney cancer. Oh, this is another phenomenal case. It had failed medical treatment, surgery, and chemo. And after all that failed medical treatment, he's given 6 months to live. And he came to see me for a second opinion. I said, like I tell everybody, try it a couple of weeks, maybe give us 2 months on a tough one like this. And he made some remarkable recovery. And I quote, I tell my friends that if it wasn't for Dr. Merkle, I'd be pushing up daisies by now, no doubt. The oncologist, shall I say, shocked that I was in fact still alive since my cancer is the most aggressive forms. And he said that after a year. After a year, he went to his oncologist. After 6 months on the program, patient's alive and well and improving every day, no longer needs an inhaler. Tremors stabilized, felt as good as he did at age 30. And he is 55. And the patient lived well for over 5 years. Unfortunately, he was doing extremely well. Numbers look great. But he still had some signs of cancer from the scans. And so his medical guy said, well, you're doing great. Why don't you try this new experimental chemotherapy? He died within days. And his wife was so upset, so disappointed. In fact, he was too. They tried this new experimental cancer treatment. He said, if I'd have just kept doing what I was doing. But once he went on that, he failed very quickly. And there were extreme side effects that this fellow suffered very badly for 2 weeks until he finally expired. But he wished he never would have listened to his medical doctor about doing the experimental new treatment. You can live just fine with cancer. We have cancer every day. And I said, you'll live fine for years with this. But he was convinced there was a cure. Yeah, they killed him. MS. for 15 years in a 44-year-old female. This is an exciting case. And she's been a patient now for about 20 years. And she is having frequent and progressively using a wheelchair more when we first saw her about 20 years ago. And in 5 months, she can now walk up and down stairs. You know, I was a little over aggressive on how long she's been a patient. In 2015, she had been 11 years on a program, so now we're at 15 years. My apologies. She's only been a patient for 15 years. But she was needing a wheelchair, bladder control problems, vision deteriorating, difficulty walking, unable to drive, taking those drugs, balance problems, and muscle weakness. In 5 months, she can now walk up and down stairs, vision improving, more independent, able to walk on her toes, off all prescriptions, and increased energy. Patients like a new lady, walking with confidence on both her toes and heels, and able to bounce on your leg. She even did a little dance to show me how much she's improved. Now, 11 years on the program, she continues to improve, no relapse, no meds, can jog, no longer even has a wheelchair, and can drive again, still slowly improving. I saw her just a couple months ago around Christmas time. This is May 17th, by the way, 2019, when I'm recording this. And I saw her in December. I see her about once a year now. Her and her husband come in. And she is still improving. She's getting stronger. And she's very excited. She's about 60-some years old now. Where would she be if she hadn't tried a safe natural option? Should be dead. Should be dead. Or in a wheelchair, rotting away somewhere in a nursing home. So it didn't happen quick. But in 5 months, she was walking up and down steps. Very exciting. Give it a try. Ulcerative colitis. No longer needs blood transfusions. Hers was so bad. She'd had it for 40 years. Nothing else. Spent weeks of my life getting blood transfusions. And the last month, during her pregnancy, last month was spent in the hospital. And you can read through that. But this patient came to me, and as you can see, my physician was horrified that she came to me. She's a nurse. But within 1 month, I stopped bleeding for the first time since I was 9 years old. She's about 50, and she has bled every day of her life since 9 years old. Wow. She developed epilepsy at 40. And the vitamins we put her on to help her colitis helped the seizures. Now she writes, please understand my degreed RN. I've worked in hospital operating rooms for years, not easily convinced of anything outside the realm of traditional medicine. However, the program Dr. Merkle put me on has had lasting effects. I feel like everyone else who does not have colitis feels for the first time in my life. I'm not facing colostomy because of the toll in my lower intestine. My colonoscopy was perfect. And I feel like no matter what health issues I may face in the coming years, I will not have to face transfusions before anything else. This is about saving lives, isn't it? Think of her quality of life now, and her family, and her grandkids, and etc. that she's now able to enjoy because she's not sick. That's what we do. That's what we do. Parasites. Yes, blood tests can indicate the parasites, and there's some nice protocols we have that'll get straightened out. We have SBN members talk about how they're doing and how they like the reports. More doctor testimonies about how they're doing. Oh, this is a great case. This is from Dr. Andrew Dyer, one of our team members here at Take Two Healthcare in Dayton. And this was reported just on 10/15/2018. I'm going to say again, today I'm recording this on May 17th, 2019. But a 5-year-old presented to Dr. Dyer as a patient. He hasn't needed an inhaler in the 7 months since he's been on the SBN vitamin and dietary program that Dr. Dyer put him on. The patient, 5-year-old boy. Severe breathing issues prevent him from enjoying time outside with family, friends, and neighbors. He has a variety of food allergies. He was highly motivated to get better so he could start participating in outdoor play. At 5 years old, he didn't need to be prompted to take his vitamins with meals. Through 8 months, blood showed near normal levels of vitamin D. They improved, reduced inflammation in the liver and pancreas as well. His father reports to me that now he can go outside and play with his brothers. Wow, isn't that exciting? Able to play without using his inhaler. In fact, he hasn't needed the inhaler in 7 months. He's been on the vitamin dietary program. He has no seasonal allergies now. Skin is clearing up. Eczema was a problem previously. And he's off the following meds. Look at the meds he's off of: albuterol, Singulair, Claritin, and Zyrtec. Wow, this boy's life has changed, isn't it? Boy's life is changed. Very exciting. Another doctor talks about how they're doing. More comments about doctors, and consider the possibilities, everybody. Whether you're a patient with health problems, maybe this will give you some encouragement, a vision of what's possible. Not saying it'll happen for you, but maybe it's possible. As I tell everybody, maybe there is a simple, safe, natural solution for your serious problem. And once you try 2 weeks or 2 months to try a safe, natural option, because if a natural option is going to work, you're going to see change within a couple of weeks. Or 2 months at least. So hope this has been a benefit to you. If you have health problems, we'd love to see if we can help you at our clinic here at Take Two Healthcare in Dayton, Ohio. Or if you prefer a doctor in your area, we can probably help you with that too. So like I tell everybody on my radio, when I close radio show every weekend on WHIO.com, News Talk Radio, WHIO. Do something today to be healthier than you were yesterday. I'm Dr. Merkle. Have a great day.